Hey everyone, I'm Joe Kennedy, and I'm a sixth year in the clinical psychology training program working with Dr. Dennis McCargue. So I think I'll start off talking a little bit about my research interests. So broadly interested in comorbidity between mental health and substance use disorders. A little bit more specifically, I kind of focus in on harm reduction, and a few of my latest projects have kind of looked at harm reduction in a variety of populations. So first, I've looked at harm reduction in college populations. So for alcohol use, lots of college kids use alcohol, college students use alcohol, and what are they doing to keep themselves safe from the common harms that are associated with this use? So, how do they keep themselves safe? How do they keep those around them safe? And how do they keep the community safe? So we've looked at a couple different studies looking at protective behavioral strategies that students employ in these situations to keep themselves safe. Kind of another arm of that research looks at individuals on probation. So for a variety of different crimes, I'm looking at how to reduce recidivism. So what can we do in these populations to reduce the likelihood of those individuals committing another crime? So we basically did a program evaluation, looked at recidivism in that population after individuals went through a restorative justice intervention, and we found that they were less likely than a similarly matched cohort that did not go through this program, so they reduced recidivism overall, which was neat. And then finally, I've been working on my dissertation, which looks at sexual assault and harm reduction as far as, when individuals go into a variety of college contexts, what are they doing what protective behavioral strategies are they doing to keep themselves safe from sexual assault? Because we know through the literature that students employ a lot of different strategies, whether it's bringing friends with you that you trust, or watching how much alcohol you consume, things like that. So we want to figure out, kind of update some outdated measures and apply them to common college contexts. So what do individuals in these situations do to reduce the likelihood of being sexually assaulted? So really not trying to victim blame or anything like that, but more so understand the reality of these situations and what are individuals doing in these situations to keep themselves safer, so that we can disseminate those strategies to other individuals that could benefit from them. So mainly, my research really focuses on comorbidity, the intersection of mental health and substance use disorders, and kind of comes from a harm reduction theoretical framework, or harm reduction framework more so. In my clinical work, I've worked in a whole variety of different settings. So I've had a bunch of different externships during my time here at UNL. I had the opportunity early on to work at Head Start for a year, which was a really neat opportunity, a really great experience. Then I went on to work at a probation setting, so working, doing assessments and individual therapy for individuals on probation, mainly with substance use issues. Sometimes some other things crept in there, like PTSD or other mental health diagnoses. Then I moved on to the forensic hospital here, or the psychiatric hospital here in Lincoln, working with a forensic population. So kind of focused on competency restoration and not responsible by reason of insanity populations, things like that. They were housed there as well. Really great opportunity getting to work with forensic populations there. And then most recently, I worked again at the Lincoln Regional Center, which is the psych hospital here in town, with a sex offender population. So in a sex offender rehabilitation program, a sex offender treatment program, working with sex offenders who had been convicted, who were now going through the treatment process to mitigate their risk and make sure that they were ready for reintegration into society. So those have all been really great opportunities here at UNL. I feel like I've had a great general training from, working at Head Start to the probation office to the psychiatric hospital here in town has really given me a well-rounded and good understanding and appreciation of a variety of aspects of the intersection between comorbidity of mental health and substance use disorders, which has been really neat for me. As far as teaching goes, I've had a variety of opportunities here as well. So my first year here, actually my first semester, I was a lab instructor for Intro to Psych, which was really neat. Then after that, I came in with some prior teaching experience, so they actually allowed me to be the sole instructor for clinical psychology for the undergrads, which is a really neat opportunity, great opportunity to work with all the students there. And then a little bit more recently, I was actually able to work with our first and second year graduate students. So I was the assessment TA for the department for the graduate students. So I worked with individuals learning the WACE, and then the first year's learning the WACE, and then the second year's working on like the MMPI, the MCMI, and the PAI, so the personality assessments there. So really fun opportunities here, and it's been really nice to have a variety of different research, clinical, and then teaching opportunities, and they really try to match those to your needs and what you're interested in as well. So that's been really great. I feel like my training here has been really well-rounded, which is fantastic. And Dr. McCargy does a really nice job of working with you to personalize that training. So you meet with him every week individually. You'll have a lab meeting as well. So he will really work hard to individualize your training while you're here at UNL and expose you to a variety of experiences that he thinks will help you grow as a professional, but then also things that you're interested in as well, which is really neat. And then finally, a little bit about living in Lincoln. So I really enjoy living here. Me and my family have found it really a nice, safe, comfortable place to live. We live pretty far south, so it almost feels like a little suburb. We're about 15-minute drive up to campus, which is no big deal whatsoever if you're from a big city especially. So I grew up in the Twin Cities, so a little bit more familiar with, driving 45 minutes to work, something like that. So not that big of a deal. We like it down here. Really feels at home, lots of paths, lots of things to do. So yeah, like I said, we feel really comfortable. So overall, I'm working on my internship interviews right now, so I'm getting right into that process. They're starting this coming Monday, so really excited about that and ready to move on to the next step. So overall, I feel that UNL has really done a great job of preparing me for the next step, and I feel like I am ready to move on to internships. So if you all have any questions, feel free to go to our lab page, find our contact information, reach out to any of us. We'd be more than happy to answer any questions that you may have about UNL, Dr. McCargy, and our lab, or living in Lincoln as you kind of think about where you might want to be going to graduate school and what kind of fit would be great for you. So look forward to meeting you all. All right, take care.